Thanks to a breakthrough surgical technology, there is a new category of minimally invasive surgery. Using the Da Vinci surgical system, SSM surgeons are now able to offer a safe and effective minimally invasive option for a wide range of complex surgical procedures.
We've been doing the Da Vinci for a couple of years now, and what we have found is that there's numerous mechanical advantages to the Da Vinci robot over a straight laparoscopic prostatectomy and certainly over an open prostatectomy. First of all, there's dual high-definition optics in the camera lens, which gives you a stereoscopic depth of field, and it's also under 10x magnification, so that gives you tremendous detail. It's virtually a bloodless field because of the insufflated abdomen compresses any venous bleeding, so there's virtually no bleeding. And what that gives you is tremendous detail over the anatomy, and I personally think that lends itself to a more meticulous dissection. What we're seeing clinically is that patients are recovering quicker. They stay in the hospital routinely less than 24 hours. They go home the next day usually with a catheter in for a week. Whereas with an open prostatectomy, we used to leave those in for 2 weeks. I think that the connection of the bladder to the urethra is much more watertight and much more precise. And I think that overall lends itself to a more rapid return of continence, urinary continence.
So we're currently very busy doing minimally invasive valvular surgery, both aortic and mitral. But with our current technology and our current techniques, we still have to make an incision and subsequently spread the ribs, and fairly significantly spread the ribs. What the robot provides is a complete and total endoscopic approach to valvular heart surgery. There are working and endoscopic ports, but absolutely no rib spreading, no retractors used with a fully robotic platform.
Actually, most kidney tumors discovered today are small lesions. Usually they are discovered incidentally during a CAT scan of the abdomen or MRI for other reasons, etc. So the bulk of these tumors are very small, and usually 95% of the kidney is still normal, so it seems a shame to us in the business of nephron or kidney sparing to take a whole kidney for these small lesions. Partial nephrectomy obviously can be done through an open incision or laparoscopically. The main advantage is for the patient. If you ask a patient what would they rather have, 4 little holes in their abdomen that don't even require closing, or a large incision or side, they certainly would prefer the 4 little holes. So I think the advantage mainly is for the patients less pain, less blood loss, shorter hospitalization, and return to work time shorter.
I really haven't been this excited about learning a new technique in many years. Not only is it a very elegant way to do surgery, you know, the operative field is magnified by 10 times, so you can see the adjacent structures. You can do retroperitoneal dissection very easily, which, you know, I wasn't particularly comfortable doing before laparoscopically. And so then you can see the ureter easily, you can see the big blood vessels very easily. And in surgery you can see the tissue planes very well, so you do dissections that normally you wouldn't do laparoscopically, and would only open the patient for in the past. But the real satisfaction comes when you round on the patients postoperatively. When I round on patients post-op the same day, I'll have them do a practice pull on their incentive spirometer. Well, even with the epidural, which was actually a big improvement in getting patients comfortable and moving after a hysterectomy, even with the epidural, I had to struggle frequently to encourage patients to pull 500 cc's to 1,000. Now I go and I see these folks that have the Da Vinci hysterectomy. They are very comfortably pulling 2,000 cc's with no problem at all. Getting out of bed, moving around, minimal pain. And this is without the epidural. This is all with minimal pain medications. And most surgeons can appreciate the benefits of being able to take deep breaths, minimize blood clots, minimize atelectasis, pneumonias, etc. Patients just do better.